I, Dr. Shekhar Paranspay, welcome you all for webinar arranged to salute three great contributors in Indian ophthalmology. First, it is nice to see you all hale and hearty. As you all know, my father, Dr. Bhaiyyasaheb Paranjpe, passed away on 14th August 2019 after a brief illness. His living in this world was on his terms, and his leaving this world for heavenly abode was also on his terms. Immediately after Baba passed away, I text WhatsApp message to senior Dr. Nagpal sir about his demise. Nagpal sir replied me back immediately with a message which I will read verbatim here. Shekhar, his death needs celebration. I am envious of him. Make his birth and death days as CME days. You should and must invite guest speakers. Love to Gaurav. After this message from senior Dr. Nagpal, thinking started and a real function was planned in Sangli on 16th August 2020, that is today, Sunday. We decided to salute real warriors of Indian ophthalmology, Dr. Manish Nagpal from Ahmedabad, Dr. Samar Basak from Kolkata, and Dr. Suhas Haldipur from Panvel by arranging real function. But COVID-19 created a havoc. And once nationwide lockdown was announced on 22nd of March 2020, we immediately not just postponed but cancelled the function. The live celebration was cancelled. But webinar platform gave us again a fresh lease of hope. So again, we swung into action, and here we are again in front of you on the world scale with this webinar. It is nice of Ophthalmology Social Association Sangli to volunteer this Dr. Y.M. Paranspay Memorial Celebration function under its aegis. Dr. Paranspay family appreciate gesture shown by Ophthalmologist Social Association Sangli. I request Dr. Vidyasagar Savgule, our Secretary of Ophthalmology Social Association Sangli, to take over the proceedings. Dr. Vidyasagar, please.
Good evening. Sangli, from the banks of River Krishna and from the place where Nightingale of India, Lata Mangeshkar, was born and brought up, and from the Karma Bhumi of pioneer of cataract surgery and legend of ophthalmology, Bhaiyyasaheb Paranjpe. And on behalf of Ophthalmology Social Association Sangli, President Dr. Shekhar Paranjpe, Treasurer Dr. Sachina Inapure, Clinical Secretaries Dr. Pooja Bhomaj and Dr. Archana Biradar, I welcome you all to today's webinar. This is a unique webinar in the sense that it commemorates the memory of Doyen of Indian Ophthalmology, Dr. Bhaiyyasaheb Paranjpe. As Shekhar sir just said, we had planned it as a physical event with felicitation of some legends of ophthalmology who had interacted with Bhaiyyasaheb. But due to the COVID situation, we have had to shift it to a webinar format. Scarcely anyone among newer generation of ophthalmologists would know the enormity of Bhaiyyasaheb's contribution to cataract surgery. In an era of aphakic cataract surgery, Bhaiyyasaheb not only used IOLs in his surgeries, but he also taught and encouraged other ophthalmologists to do so, thus accelerating the benefit to the patient of the use of IOLs and removing the phobia of the same in the society. To keep his memory alive among the present generation of ophthalmologists, we feel that this webinar become an annual event addressed by who's who of ophthalmology. We request the MOS to add this into their calendar and make it into an annual event. We have with us today Dr. Suhas Haldipurkar, Dr. Kuresh Maskati, Dr. Samar Basak, Dr. Manish and Dr. Prashant. We will be virtually felicitating Dr. Suhas Haldipurkar, Dr. Samar Basak, and Dr. Manish Nagpal. Dr. Kuresh Maskati and Dr. Prakash Amte will be sharing their thoughts. I now request Dr. Dayanand Naik to take the function forward. Dr. Dayanand Naik.
Hello. Thank you. Thank you, Dr. Vidyasagar. I'm Dr. Dayanand Naik. Welcome you all. When Dr. Bhaiyyasaheb Paranjpe passed away the last year, Dr. Nagpal Senior had sent a message to Dr. Shekhar. What Shekhar shared with you all. Dr. Nagpal Senior said it needs celebration and there should not be any sorrowful event. What a great message from Dr. Nagpal. Sir, that message says demise of Dr. Bhaiyyasaheb should be celebrated. Dr. Nagpal, your message changed the scenario, and on those lines, today's function is planned. We all on this floor request you to bless us and give go-ahead message. Dr. Nagpal Senior, please.
Good evening. Welcome to this workshop which you have planned. I am reminded of a book which I had read about 20 years before. It was an autobiography of an ophthalmologist in Hungary. And he had written the book in Hungary, Budapest. And he translated it into English while staying in America. That was titled as Fighting the Third Death. Fighting the Third Death. Normally, we all know there are three deaths, stages of death. The first one is the loss of coordinated functions, the respiratory failure, brain stroke. And then for 15 days, there is a continued death of the individual cells which constitute the man. That is the second, when the nails continue to grow, when the coordinated function continues. And after this comes the third stage of death. The third stage is that you remember him because you saw something connected to him in your house, or you remember him because his name was shown somewhere. That kind of a thing happens in the third death. Till the persons who knew him, the things which were associated with him, and everything connected to him, which was always reminding us of him, that remains. And finally, death comes when the persons who knew him also die. This is the third death. Bhaiyyasaheb fought the third death very well. He contributed to the science, he contributed to help his colleagues. He was very impressive. I was very lucky that he came to Ahmedabad, stayed for 20 days, and we used to discuss the things. With these few words, I would like to give you the go ahead. Go ahead.
Thank you. Thank you very much for your blessings, sir. Now I would like to request Mr. Kishore Masurkar, Entot Pharma Chief. Kishore, please. You're unmute problem. Please unmute yourself.
Yeah, thank you, doctor. And third, really feel privileged that we are getting an opportunity to host this webinar of such a great legend in the ophthalmology, Dr. Bhaiyyasaheb Paranjpe. We are in this field for last 45 years, and in those days, he was almost the only name in ophthalmology in the Western Maharashtra. I fondly remember meeting him with my late father and was really shocked to see his modesty and courtesy towards us. That first meeting itself was made an impact on my mind. And I have learned that in life, however big you are, you have to treat others as equally important. In my lifetime and also working in the field, I don't think I have seen somebody like him or will ever see someone like him. I thank Dr. Shekhar for giving us this opportunity. It is really a big privilege for us. So thank you.
Thank you. Thank you, Kishore. Dr. Bhaiyyasaheb was a genius, multifaceted personality. How often facets become assets? Rarely. But it was with him. He was a perfectionist. Whatever things he used to do, those things were so focused and with perfection and noble intentions. Being a sports person and a theater activist, he was knowing importance of teamwork. Obviously, he was keen to develop everyone around him. Watching his performance used to tempt his colleagues to follow him. And really, they used to follow him. Dr. Quresh Maskati is one of the good associations of Dr. Bhaiyyasaheb Paranjpe. Dr. Maskati, ex-president of All India Ophthalmological Society, wants to say about Dr. Bhaiyyasaheb. Dr. Quresh Maskati, please.
Yeah, can you hear me now? Can you hear me?
Yes, yes.
Yeah. So just to repeat, because I'm not sure how much you heard. So I thank Shekhar Paranjpe and the Paranjpe family for inviting me to share my thoughts about Shekhar's dad, the late Dr. Bhaiya Paranjpe, whom I knew from even before I became an eye surgeon, because my father and he were very, very close friends. And so we have gone to Mahabaleshwar on holidays, and he and his family have come. And as a student also, I interacted with him. Of course, I came to know him much more closely when I became an eye surgeon. And there are few lessons that I have learned from Dr. Bhaiya Paranjpe. I have only 5 minutes, so I distill the 4 important life lessons that I have learned from him. Let us see them one by one. This is Dr. Paranjpe early on, and this is Dr. Paranjpe later. But the face changes, his attitudes never changed. Next. So the first thing I learned from him was the ability to stay focused. Dr. Y.M. Paranjpe was the first to start using an operating microscope way back in 1972. Did numerous free surgeries in camps in his hospital. He never distinguished between rich and poor. If a poor person came to his hospital, he got the same VIP treatment as a paying patient came to his hospital. I spent time with him in his hospital and have seen this for myself. He was the first to start an eye bank in the private sector in 1973. He realized that government service eye banks are not sufficient, and that the scourge of corneal blindness is huge in Maharashtra. So he took the initiative to start an eye bank in 1973. Later on, he started a public trust and put this eye bank under the trust. And he was a prolific surgeon. I believe he once did 192 cataracts in a day in a camp. Another time he did 34 sac excisions. This earned the admiration of Peter Watson of Moorfields, again somebody whom I've seen in Moorfields. Peter Watson, for those who don't know him, is a legend in ophthalmology himself, a pioneer in everything to do with sclera, glaucoma, multiple interests. He spent time with Bhaiya Paranjpe in an eye camp, and he tried to persuade Bhaiya Paranjpe to write this up in a paper. And Dr. Paranjpe protested at that time that, I mean, lots of people do eye camps. What is the big deal? Why should I write up a paper on this? But Dr. Watson, or Mr. Watson as he was known, was extremely persistent. And he says, no one does an eye camp with the same focus that you have. The methodical approach, the infection-free approach way back in the 70s, the amount of importance you give to prevention of infection and to a particular modus operandi in the eye camp, I have not seen in any eye camp anywhere. So that was great admiration to Bhaiyyasaheb's ability to stay focused on whatever the job at hand. Whether he was doing his first surgery or his 191st surgery in the same day, the results were the same because of his unique ability to stay focused. If the younger generation can imbibe just a small portion of this ability, it would do them a great deal of good. Next. His ability to stick to his beliefs. He was in a minority who believed IOLs were the future of cataract surgery. I remember him attending a session in Dr. Nagpal's. Dr. Nagpal had every couple of years, he had a lovely session in the Tagore Hall in Ahmedabad on recent advances. And once in the late 70s or early 80s, there was one on IOLs. And at that time, there was hardly anyone doing this. And people were laughing at these people for doing IOLs because intracapsular cataract surgery gave perfect results of 6/6 vision. He was one of those few at that time, with a few foreigners who had come in, who sincerely believed IOLs were the future. He stuck to his beliefs. He was not deterred by so many naysayers and critics who said, stop doing this, you're doing more harm than good. He was amongst the pioneers of doing IOL, started way back in 78. Even all the ridicule didn't allow him to give up because he was convinced Indian IOLs could compete with the world. And again, a hats off to him. He stuck to the Shah and Shah IOLs. Mr. H.M. Shah from Calcutta, I remember, was so touched by this. The imported IOLs that started coming into the market, but he says, no, the Shah and Shah IOLs are equally good, and I will use only the Indian IOLs. And he pushed Shah and Shah to innovate, to make IOLs the way he wanted them to. Then when HPMC came in, he persuaded Shah and Shah to make the Indian HPMC, which was marketed as Visilon. And just as Coke is synonymous with aerated waters, at that time Visilon became synonymous with HPMC, thanks to the amount of push that Bhaiyyasaheb Paranjpe gave. So the second take-home message is stick to your beliefs. If you believe you are right, if you believe what you're doing is correct, just continue on the path. People will finally follow you. But if they do or they don't, you will do what you feel is right. Third, the sharing of skills and knowledge. Again, since Dr. Nagpal is here, I remember an incident not concerning Dr. Paranjpe. This was a ptosis surgery CME which was going on. And there was a professor from Delhi who was demonstrating ptosis surgery. And the audience told him, sir, we cannot see these steps because your body is covering the sutures. So we can't see the intricate steps. And he turned to Dr. Nagpal and said, how can I show them all the suturing exactly the way I do it? Then they will be better than me later on. So there are teachers like this who actually prevent students from learning. Dr. Bhaiya Paranjpe was exactly the opposite. He was a teacher by example. He allowed students from all over the country to learn from him by observation. They came and stayed with him. He went everywhere, as Dr. Nagpal said. He came for 20 days to Ahmedabad. He conducted workshops on IOL all over the country. Wherever invited, he never refused either to conduct a workshop or to speak on IOLs or to speak on the method of cataract surgery. the extracapsular cataract surgery. So he never shirked, and he taught with his heart. He taught you everything that you needed to know. So he shared each and every skill that he possessed, a virtue of a tremendous and a great teacher. Again, a lesson for the youngsters who will become teachers tomorrow. Share with your students. They will never become better than you. They will always be so emotionally attached to you that their difficult cases they will send to you, and there is no greater reward than a student sending his tough cases to you, or a student acknowledging you in front of a crowd. So Dr. Bhaiya Paranjpe was a teacher really by example. And the fourth message is to enjoy life beyond ophthalmology. As mentioned, Bhaiyyasaheb enjoyed and played actively several sports, whether it was badminton or whether it was, you name it, and he played it. If you see the picture on the left, he was game to attempt skiing at the young age of 62. His passion was for literature. His passion was for music. His best of friends were non-medical people. Medical people are your colleagues, but his best of friends were non-medical. You see the picture of him hugging Naval Baliwala, best of friends, though he was an optometrist and an optician and an instrument dealer, they were the best of friends. Pula Deshpande, Bhimsen Joshi, they all visited him, visited his house, had sessions with him. He was a Rotarian. He was the president of the Rotary Club of Sangli. So he had varied interests. This is something that I have imbibed from him. I enjoy singing. I have no great singers because I am not a great singer, but I enjoy singing. I have attempted several sports, all of them very poorly, but I enjoy very, very many different things. I have been a president of my Rotary Club. So these are things that I have learned from him, that you enjoy life. Ophthalmology is not the be all and end all of everything. You will be very narrow-minded if you're just a great ophthalmologist. So Bhaiyyasaheb really embodied this, that he enjoyed life outside ophthalmology. Again, something to be learned by one and all. Next. I could go on, but time makes me stop here. I thank you for your attention, and let us all try and follow at least a little bit of the multiple lessons that Bhaiyyasaheb has taught us. Thank you so much.
Thank you. Thank you so much, sir, for the great portrait of Dr. Bhaiyyasaheb Paranjpe. You have talked about his academics, his extracurricular activities. Thank you very much. When we speak of Bengal, there are few things. Hello? When you speak of Bengal, there are few things where Ravindra Sangeet is there, movies are there, fish and intelligence and magic. All are the features of Bengal. Previously, magic was dominant. May I request Dr. Viras Pradhan to introduce Dr. Samar Basak from Kolkata.
Good evening. I just need a minute to get my presentation up.
Should I share the presentation?
I think so, Gaurav said, because I can't seem to be able to share it.
Yeah.
It's not coming up.
Okay. Yes. Okay.
Okay, wonderful. Thank you. It is an honor and privilege to speak of one of the most eminent surgeons and academicians in Indian ophthalmology, Dr. Samar Basak sir. Basak sir is a director and one of the founding members of Disha Eye Hospitals, one of the largest chains in ophthalmic eye care, with 14 branches in West Bengal and in Eastern India. He is renowned as a doyen in the field of corneal surgery in India and internationally. Next slide, please. He has been instrumental in setting up one of the finest independent eye banks in India, which retrieves around 2,000 eyes every year. He is also a key policy maker for the Eye Bank Association of India and the Government of India. Next slide, please. Sir has numerous textbooks and more than 41 publications to his credit in prestigious peer-reviewed international journals. Sir is also the editor and reviewer for the Indian Journal of Ophthalmology, the British Journal of Ophthalmology, and many others. He has the rare academic gift of communicating with senior peers as well as with beginner students. An overwhelming number of students in India, I'm sure, are grateful to Sir for making their lives much easier, especially with his two textbooks which are shown up there, especially the oral and practical Viva books. Next slide. For his immeasurable contribution to ophthalmology, Basak sir has been honored with many awards from the All India Ophthalmic Society, the American Academy of Ophthalmology, and the European Society of Cataract and Refractive Surgeons, including the very prestigious Senior Achievement Award and the Senior Scholar Award, both from the American Academy of Ophthalmology. Next slide. They say that the art of teaching is the highest form of understanding a subject, and Sir has always been generous in sharing his knowledge with his peers and the next generation alike. He is involved in teaching and training programs for phacoemulsification surgery, small incision cataract surgeries, and endothelial corneal transplants. He is involved with global teams like Orbis and SightLife. I consider myself extremely fortunate to have spent more than a year at Disha Hospitals as a corneal fellow under his wings. His dedication and work ethics are what really inspire his team and future doctors. He's absolutely top on time every morning, even on a Sunday, to see his post-op patients, while some of the fellows will be still scrambling to make it on time. Sir takes a very keen interest in making sure his fellows are learning optimally and spends adequate time with them on each and every morning round. In contradistinction to his rigor and meticulousness of practice is his caring nature and concern towards his colleagues and students. I fondly remember him coming up to my room by his own accord once when I was unwell, making sure I was seen by a concerned physician and then packed off home to get to fully recover. Next slide, please. Gaurav, yeah. As the Japanese proverb goes, that better than 1,000 days of diligent studying is one day spent with a great teacher. I most certainly speak on behalf of all Sir's students and fellows. My fellowship with Basak Sir was the most crucial and rewarding period of my career. The clinical and surgical skills I was imparted with made me confident, opened up a completely new set of avenues and opportunities. Next slide, please. To conclude by mentioning a unique hobby that Basak Sir has, he collects and studies stamps related to ophthalmology. He has more than 650 stamps in his collection and has also authored a book. Sir will today, in fact, take us through his interesting collection of the philately. I am sincerely grateful to Dr. Shekhar Paranspay sir for this opportunity to introduce my mentor, Basak sir, the recipient of this extraordinary honor in the fond memory of the legendary Bhaiyyasaheb Paranjpe. Thank you. Over to Basak sir.
Thank you, Viraj. What is happening? Viraj's screen is coming.
I'll just try to turn it off, sir. Could you try and share your screen, sir? Maybe
I am trying, but it is your screen is showing. रिद्धि एदिके आए देखिए এটা ওটা কেন হচ্ছে
What I'll do is I'll just try to leave the meeting and come back. So maybe it will stop the screen. Screen share. Okay, that's it.
না না হচ্ছে now can you see my slide
Yes.
Yes, sir.
thank you Viraj for your kind introduction and thank you Shekhar for giving and honoring me with this for this oration award by your father, Dr. Bhaiyyasaheb Paranjpe. I have put these 3 stamps with his photograph. One is stamps on iCamp. We have heard a lot from Quresh. Then one stamp on mature cataract. One is, this is the picture of Von Graffe. And I have heard he was master in ab interno incision by Von Graffe's cataract 9. My pranam, sir. So I will be talking on ophthalmology, a journey of ophthalmology through postage stamps of the world. So ophthalmology is equal to the ophthalmology and philately. I call it as a super specialized philatelic hobby. It consists of postage stamp, cancellation, first day cover, miniature sheet, maxim card. And the history of ophthalmology goes way back 5000 BC. And you know these stamps. This is the eye of god Horus. This is the story of blindness, and Radha, sun god, restored the sight of Horus by real organ transplantation. Whichever we write in RX, in all our prescription, in all specialty, it means you take this prescription with an oath to the sacred eye of Horus. You know, the ID was the first known eye doctor in 6th Egyptian dynasty. And ever papyrus is the first known ophthalmic document. Then if you see this stamp, lower one is the foreign body removal from the eye by an Egyptian eye doctor. You know, the Ayurveda is the Upanga of Atharva Veda. Here the saying is Nayanam Pradhanam. We know that Shushruta in 600 BC, he was the pioneer in cataract surgery and described 76 eye diseases with their management. Hippocrates first wrote the elaborate chapters on physiology, pathology, and treatment of ocular disorders. Aristotle gave the vague conception about the ocular structure, a sphere of 3 coats filled with uniform ocular fluid and connected with the brain by 3 hollow tubes. Then Galen described hypocyma, that is the cataract, as the leakage of viscous fluid near the pupil between iris and the lens. I have stamps on anatomy and physiology. You can see section of the eyeball, the lens system, inverted retinal image, human and eye and relationship with the human brain. So we have some stamps on ocular examination, vision testing, lens chart, retinoscopy, lead eversion in trachoma. Then slit lamp examination, direct ophthalmoscopy, and indirect ophthalmoscopy. There are some non-ophthalmic personality. We have to remember them. Alhazen or Ibn Haytham first formulated the present-day concept of light of vision. He is considered as the father of optics. If you see the stamps, it is written there, father of optics. Nicholas of Cusa first was the inventor of convex lens spectacles for myopia. Then Leonardo da Vinci described 3 coats of eyeball, again the hollow optic nerve, and first introduced the concept of contact lens. But it was the Andres Vesalius who first showed that optic nerve is solid, not hollow or tubular. But due to some unknown reason, he was unable to trace the optic nerve to the optic chiasma. Then this is my favorite stamp, René Descartes, cogito ergo sum, I think, therefore I am, was his famous philosophy. He established 3 laws of optics. He proposed the pineal gland as the third human nerve. If you see these two stamps, there is an error in the stamp on the left-hand side. And you know that I possesses both the stamp. This stamp is $3. This is now more than $300. Galileo studied medicine, but his interest was astronomy and physics. Most effective LVAs are based on Galilean telescopic principle. Kepler, he was a physicist. He first coined the term prism, lens, and meniscus. He is considered as founder of dioptrics. Sir Isaac Newton, he described the entire system of optic and dioptric system of the eye, including scientific theory of color vision. Then Benjamin Franklin invented the bifocal lens. This left-hand stamp is the 5-cent stamp. On the left is the first known adhesive postage stamp in the world, and it is very expensive, though I do not have this stamp in my possession. Then we have Helmholtz. He was the inventor of direct ophthalmoscope. He was also postulated the theories of color vision and accommodation. And this is Zeiss and Abbe. The today's Zeiss instrument, we know that Zeiss microscope. This was founded by Zeiss and Abbe. But the interesting thing is that they first introduced the concept of 8 hours working day, paid holidays, and pension scheme for the workers in a company. Then Jacques Daviel, he accidentally discovered the ECCA. He is considered as father of modern ECCA. Then this is my favorite stamp. If you notice this stamp, there are 2 storied stamps. He is known as Dr. Eisenberg, a miracle doctor who used to travel from town to town performing cataract surgery, of course by couching. If you see his right hand, there is a couching needle here. He is the doctor. And this stamp depicts that the Dr. Eisenberg approaching a patient for couching, whereas while his assistants and playing trumpets and bell to attract patient, advertising in 17th century. Then you know that von Haller, Haller's layer of choroid. Sir Joseph George Beer, he is considered of father of ophthalmology. Then von Alt, you know the Alt angle, was an excellent surgeon and inspiring teacher, and see his student was von Graffe, Baker, Sattler, Budgmeister, Fuchs, and Dimmer, all are his student. And you know that Donder first analyzed various types of refractive error, including astigmatism. We all know the Donder's principle of eye. This is von Graffe. He is pioneer in clinical ophthalmology and role of PI in angle closure glaucoma. He founded German Ophthalmic Society and Archive of Ophthalmology. Unfortunately, he died very early age, 42, due to tuberculosis. You know that Jules Gonin, he first introduced the concept of RD surgery, the seal the break. He is considered as the father of modern retinal detachment surgery. Filatov first proposed the use of cadaveric gonad. He is the father of eye banking. Then Barakar, the old people might be knowing the Erisofek, same Barakar family, the grandfather of Karen Barakar, Erisofek cataract extraction. This is Fred Ollo, and you see the IOL. He established the quality IOL factories for the poor. One is there in Tintgonga Eye Hospital, Nepal. So we know that Morquio syndrome, the Behcet syndrome, I have all stamps. And these are great, all you know the great people, they have also Galston, Filatov, Gonin, Joseph, Gorge, and Blaskowitz. We know that Blaskowitz ptosis surgery. And this is the twin stamp. You see that this is the Spitfire fighter plane, and this is Sir Harold Ridley, inventor of IOL, who changed the world ophthalmic scenario. in the present state, and first IOL was implanted in 29th November 1949. There are some Nobel laureates in ophthalmology. Albert Galston is the only ophthalmologist who received Nobel Prize in medicine or working in ophthalmology field in 1911. But other ophthalmologists got the Nobel, but their work is not in the ophthalmology field, like Fred Pregel in chemistry. His chart, we know this squint, he got in medicine. Then this neurobiologist got Nobel in ophthalmic with Hubel and Wiesel and Wald and Granite. Wald, you know that vitamin A Wald cycle is there. Then there are some ophthalmic personalities famous for non-ophthalmic contribution. Petrus Hispanus, he was famous for his book Liber Ocularum. He was the Pope John 21 in 1276. You know that Jos Rolla or Jos Rizal, he was an ophthalmologist, a national hero, martyr of Philippines independence, and he was sentenced to death on 30th December 1896. And 30th December is the national holiday in Philippines. This is Carlos Finlay. He proposed that mosquito is the vector of yellow fever. He was an ophthalmologist. And Zamenhof, he was high myop himself, invented Esperanto, a new international language. And you all know this. See this man is Sir Arthur Conan Doyle. He was an ophthalmologist. He gave up his eye practice at 1890, and he realized that he could earn more money as a detective writer than an ophthalmologist. Then diseases of vision, 29, you have already seen: cataract, trachoma. Then we have corneal blindness, river blindness, refractive error, low visual aid, glaucoma, beautiful stamp of glaucoma. You see the diabetic microangiopathy and diabetic retinopathy, hypertensive retinopathy. You could see the soft exudate and flame-shaped hemorrhage. Then some investigative stamps on ERG, CT scan, MRI, ocular microbiology, and you see that this stamp is horrible. This is Halberstadt Proazeki bodies in trachoma. You know that we used to, difficult to spelling of HB bodies we used to call in trachoma. Then some treatment like spectacle correction, eye drops and ointment, oral antibiotics, ophthalmic laser. Then cataract surgery, you see the NPC, this is also collectible item. Motiabind operation, Asan, Surakshit, and Nishchint. So NPCB mass campaign via inland letter. And these are the some photographs of eye camp. And you see the stamps on vitrectomy machine, stamps on corneal grafting. You see that cornea transplantation is written there. And then there are some stamps on eye donation, special day cover Bangladesh. This is from India, Thailand, from Mali, again from Bangladesh. And eye donation movement is also popular along with multiple organ donation. And you see that this is a lovely, beautiful stamp. And it also says that share your life, organ and tissue donation. Prevention is also there. Vitamin A prophylaxis again. Bachche ka hara pattidar sabji khilaye. So vitamin A prophylaxis campaign in inland letter in those days, vitamin A oil, diet rich in vitamin A, balanced diet, pediatric primary health care, control high BP, diabetes control, killing onchocerciasis vector black fly larva. This is the black fly or simulium onchocerciasis, which is in African country. Then industrial safety devices. Then care for the ophthalmia neonatal, trauma care, and already eradicated smallpox. Foresight prevents blindness, who declares 1976 year of prevention of blindness. And a lot of countries, including India, has come up with beautiful stamps on this theme. Then some stamps on Congress, like International Congress of Ophthalmology, previously known as ICO, used to happen 4 years. Now it is called WOC, World Ophthalmic Congress. This is from Italy. And this is in Egypt. ICO happened in this is happened in 1962 in India, then in Mexico. This is other conference, like this is also ICO from Japan, and this is the second international council, Pan-American Ophthalmic Society. Then this is AIOS, Bangalore, special term. This is Atropa Belladonna. This is Atropa Belladonna. This is Syrian Ophthalmic Society, Afro-Asian Congress. You see that European Congress, Italy, and this is cancellation, not the stamp. This is Afro-Asian Congress in India, 1976. And this is the beautiful stamps. If you see that, if you drink, this is in Greece Museum, this goblet is still there. And if you drink wine from this goblet, all the evil spirit will stay away from you. This is the theme of this stamp. This is then the 100 years of ophthalmology, 100 years of American Academy of Ophthalmology, 100 years of Mexico Ophthalmic Society. This is the stamp with Orbis International, 100 years of one Mexico Eye Hospital. Then special day cover by the 50 years of Indian Journal of Ophthalmology. So in conclusion, behind this small rectangle piece of colorful paper, there is something more. There is the passion of all ophthalmologists, expression of all our activities, and that is often also our life. There are many more, only we need to keep our eyes open. But it is now a dead hobby because no stamp is there in current era. Thank you very much for your patience hearing.
Thank you. Thank you very much, sir. It is such a great collection that ophthalmologists contributing for some extracurricular activities. You have shown whole of the span. And sir, your name should be in Guinness World Book for this contribution.
Thank you.
I was about to tell Basak that he should contribute his collection to the Museum of Ophthalmology, which AIOS has started at the headquarters.
Yeah. Sir, you have shown the Jadoo of Bengal, the magic of Bengal. We were just thinking about Ravindra Sangeet, films, Bengali sweets, fish, but you have added one more contribution, that is Bengali magic through your stamps collection. Thank you very much, sir.
Thank you.
I call upon Dr. Gaurav Paranspay, the fourth generation of ophthalmologists.
Basak sir, can you stop sharing your screen?
Trying.
Okay.
Gaurav?
Yep.
Gaurav, are you ready?
Yes, I'm ready.
Gaurav Paranspay is the fourth generation ophthalmologist of Paranspay family. Development of ophthalmology got advanced to an extent. People were in cornea for many years. Then they reached up to retina with a lot of fluency. Eye is taken care of. Vision is increasing. Things are going very well and advanced. Dr. Manish Nagpal, a renowned retinal surgeon. Dr. Gaurav had an opportunity to work with him. I think, Gaurav, you are the best person to introduce Dr. Manish Nagpal. Please, Gaurav.
Thank you. Thank you, Dayanand Kaka. So, good evening, everyone. It is our great honor to felicitate our distinguished guest for today, Dr. Manish Nagpal, sir, who has made a tremendous impact in the field of vitreoretinal surgery and has particularly been a pioneer in micro-incision vitrectomy surgery. After finishing his training in ophthalmology, Manish sir joined the Retina Foundation, the institute which was built up by our beloved Dr. P.N. Nagpal sir. It is a challenge to fill into such momentous shoes, but his hard work, excellence, determination, and perseverance has led him to further take the institute and our field to new heights. They say the teacher affects eternity, and we can never tell where this influence stops. And this seems to aptly describe Sir. Sir continued what PNN Sir had begun at Retina Foundation of training his peers and students with a fire to learn vitreoretina and helped us to be the best at what we do. To call ourselves his students is something what we do with utmost pride and joy. Manish sir has been recognized for his work by awards on numerous occasions on national and international forum, like the prestigious Macular Award, which he has received for 4 consecutive years, and I think one more recently. It is known as the Oscars in Ophthalmology, the C.S. Reshmi Award by All India Ophthalmic Society, Young Achievers Award from Bombay Ophthalmic Association, to name a few. Be it from writing books to gracing conferences with his presence, Sir always stands out for his astonishing versatility. Sir has always put patients first and worked tirelessly to ensure the best eye care was available to everyone. For patients, merely seeing Dr. Manish sir is a first step to recovery, and sir has gained the trust of many by letting his work do all the talking. Manish sir is a pioneer in macular surgeries, and his concepts are followed globally to this date. Sir has contributed immensely in so many ways to our field, and he always will be one of the most eminent ophthalmic pioneers. I would like to earnestly express my heartfelt gratitude and appreciation to Manish sir for letting us be a part of his extraordinary journey. I now request Manish sir to give his talk on recent advances on macular surgeries. Thank you.
Thank you so much, Gaurav, for these kind words. And I would also like to thank Dr. Shekhar for this great opportunity, unique opportunity to be a part of this oration of the prestigious Dr. Bhaiyyasaheb oration. Personally, I've not had a chance to meet Dr. Bhaiyyasaheb, but I've always heard so much about him through Dad over the years about the contribution that he made to ophthalmology as a whole and bringing in all the new techniques, especially the IOL, which even Dr. Quresh talked about at a time when all these things were not there, and started a revolution of sorts. And it's very impressive to see how the next generations, Dr. Shekhar has always been very encouraging and always been a great friend through the times that I've known when I started working at Retina Foundation. Always he has been coming to all our meetings, always interacting. And then, of course, finally Gaurav becoming a part of our institute, spending a few years. So it's been a wonderful journey to be associated with this very prestigious hospital institute generation of eye surgeons, which has contributed to Indian ophthalmology as a whole, and particularly to the Maharashtrian ophthalmology. So I'm deeply honored to be given an opportunity to be a part of this Bhaiyyasaheb oration award. Dr. Shekhar, in fact, sent me this unique photo of 1999 when Dad was there at a function there where a felicitation was being done. And this is one of those older photographs with a lot of memories of that time. And then, of course, Gaurav joining us left a lot of memories. We had some very good times. His colleagues, all of them remember him fondly, and so does our staff and everyone. And anybody who spends 2 years at a place becomes a part of the institute in itself. So Gaurav asked me that why don't you speak on something like macular surgeries, which is something that has become very important today, and especially with the MIVS based surgery, which has brought in these surgeries into recognition and has made a lot of untreatable so-called disorders treatable to a large extent. So I understand that there are a lot of non-ophthalmologists here, non-retina people. So I'll keep it very brief and with only visuals, which a lot of you can relate to. So when we talk of MIVS, the basic change which happened was instead of cutting open conjunctiva, putting 20 gauge cannulas, there were these cannulas which you can just put in straight away, and you're ready to start in a minute your surgical work. And at the end of surgery, all you need to do is pull them out, gently massage that area, and most of the times you don't need to suture. And if at all you put oil, you have a tendency to leak, you could put the odd suture, but it's a very much simpler way to approach vitreous than what used to be with an open 20 gauge wound, which had to be looked at. So this changed the whole technology, which brought in the advances in the small gauge vitrectomy. You'll see Gaurav's contribution. This was the time when we were collecting data of our early sets of cases and collecting and contributing. So you can see the advances in small gauge there. And the most important part of small gauge is the incision. And you can see how fine the incision is at the end of surgery. It's just a small slit. You can barely see it here. And this is where Gaurav contributed. We had designed a paper to look at these incisions using the anterior segment OCT and published the data. And you can see that this is such a fine incision. And we used to do these anterior segment OCT scans on the day after the surgery. Gaurav would do these and then do it repeated again at 15 days, 7 days sometimes, and 30 days. And we compared how the healing takes place. And you can see on day 1, day 7, day 25. And I think he put in a lot of hard work to produce this data, and it was a unique data at that time. There was nothing much existing. People had used some UBM in the past with limited, but the anterior segment OCT gave us some very good data and results to publish. And then, of course, we also looked at, with the small gauge, we compared using Nepafenec eye drops versus prednisolone acetate in the post-operative recovery period, and found that it worked equally effectively well in reducing the inflammation. And so these were some of the things that Gaurav was a part of as a part of this MIVS surgery and the healing and the vasculature part. And I'll just take you through a few cases which visually can tell you that what happens on the macula when there is a traction. You can see that this whole traction has pulled up the macula, and one can only imagine the distortion that a patient would feel if something is supposed to be well aligned in a nice curvature and something is pulled up. It's going to cause a problem. The same thing when there is a hole which forms. The retina, the fine area of the retina, which is macula, splits open due to traction, and we call it a macular hole. And that causes a lot of metamorphopsia as well as a central scotoma to these patients in that. And this used to be untreatable till a few decades back, and a lot of advances have come in related to this treatment. And then, of course, a membrane growing over the macula again causes distortion to the surface, a lot of metamorphopsia. These are all conditions which in the past were left till they reach the last stages when the vision is really low to be considered good for surgery, because the surgery was very risky in the beginning. But now MIVS has brought in a very safe, the vitrectomy systems have improved, the small incision surgery, no sutures most of the time, healing is better, the incisions are smaller. So we now operate much earlier, and so you can preserve the vision much better. So for all macular surgeries, the first step is to remove the vitreous and do a good PVD induction. And here you see we are doing a triamcinolone staining to visualize this vitreous very well, and you can see the hyaloid coming up. So this is the first step for any of these surgeries. And then there's an ILM peel, which is done in most of the macular surgeries. Here it's a macular hole that you see that we are doing an ILM peel after staining. And this is all possible due to the good visualization, the good instrumentation, the forceps, the fine details that one could see in detail and then remove. This is a traumatic macular hole that you see, a bigger hole with more ragged areas, and the same procedure being done. And recently, to enhance the closure, we've devised a new instrument we call the massager. Since a year, we've been using it. It's just a metal instrument, atraumatic. So at the end of doing a peel in these macular hole surgeries, we gently massage the edges of the hole, because due to the chronicity of this hole, which is stretched open, sometimes there's a redundancy which tends to be there and holds that tissue there. And so all we do is gently move this 360 degrees so as to relax the hole. And then after that, when you do an air fluid exchange, the hole pretty much almost becomes a pinpoint or closes on table itself using this technique. So this gives us very good results. And very recently, we also, last month in the Retina Today, we published the data on this retinal massagers use as well. Vitreomacular traction, which I talked to you about, showed you the OCTs about, again, requires a PVD creation. And after the PVD creation, we gently remove the hyaloid. In this case, we don't pull it up. We just go gently and try to make sure that the tip, which is attached to the fovea, does not split, does not deroof the hole. So you can see that we've not pulled it open. We have left it there, because in vitreomacular traction, it's easy that if you pull it, you may create a hole. So here we leave that last amount of that shaft of the residual hyaloid which is there, and then remove it by peeling the ILM rather than pulling it open. So all of these cases have minor alterations in the techniques that we do, but main aspect is to be able to visualize better. This is a sub-ILM hemorrhage which has not gone away on its own at times, and it becomes dehemoglobinized, and you can see that to approach it, we first done the hyaloid removal. After that, we get a good view of the posterior pole and remove the ILM. And once the ILM is removed, we get access to the plane of the collected blood, which we aspirate after that gently. So all this is possible due to good instrumentation, the cutters which have become fine closer to the retina we can go to. This is a classic case of an epiretinal membrane which distorts the vision in patient's eyes, and you can see that it's a very fine membrane. We remove it with the help of a forceps, and after that stain the residual area to look for ILM leftovers, which we remove so that the incidence of recurrence in these cases reduces at this time. So this is done using the stain, so that we make sure that it's gone from that central macular area. At times there is subhyaloid blood, which is this is not sub-ILM, this is subhyaloid, so it's a little easier. You don't have to move the ILM for this. You can see the whole hyaloid coming up and allows the blood in the exposed, after which one can aspirate that blood easily. So once you have the hyaloid gone, then you aspirate that central blood and gradually remove it from that macular area which it is blocking for the patient. This is also a subhyaloid hemorrhage, a less taut subhyaloid hemorrhage and a macroaneurysm. You can see a macroaneurysm which has bled and led to this hemorrhage which blocked the macular area. The visual did not clear up over a month, and so what we do nowadays is that we wait for a month, and then if it's not clearing, we would go in and remove this tissue. This is an optic nerve pit, which again, what we do in these cases is remove the hyaloid. The typical way that we stain with the triamcinolone and remove it, you can see that sensory elevation margin, which is seen here, the triamcinolone going away. And once that goes away, it allows you a better access to the area behind the hyaloid. So main thing here is to do the hyaloid removal. After this, a lot of people do different things. Some of them peel ILM, some of them laser the temporal half of the optic nerve, some stuff the ILM, a lot of things are done. But the main procedure is to go and remove the vitreous hyaloid and then put gas in these patients. A few cases just to show of chronic diabetic edemas. Most of the diabetic edemas we we use injections to reduce, but once it's very chronic or there's a traction, we go in and do surgically. So these are examples of chronic diabetic edemas. So once again, we have stain in these cases with the dye and then remove the internal limiting membrane. In these cases, ILM removal sometimes is tricky because the retina is very thin, boggy, and tends to, you can very easily create holes in it. So one has to be very careful in these cases. So this is an example of an extremely chronic edema with a thick hyaloid. So we first remove the hyaloid, and after that, once this hyaloid is removed, we stain. And here, because on the OCT, the macula is very thin, we don't peel the ILM over the fovea. What we do is just peel all around, but leave the central area intact so that we don't de-roof it or we don't damage the central area in this case. So one has to modify the technique based on what you see clinically in these cases there. And the last situation I'm showing you is the surgeries we do for large submacular blood. So this is one of the cases where you have a medium to large size collection. So what we do is create a space for where we'll make a retinectomy. We go just within this vessel of the arcade because it's a large collection of a membrane as well as blood inside. And if you make a small one, most of the times when you pull it out, the tissue out, it will cause a ragged tear. So instead, you plan a nice, neat retinectomy in this area, which we are doing with a cutter at a very low cut rate of 100 cuts a minute. So normally now we use cutters at 7,500 or 10,000 cuts a minute. Now for this particular maneuver, what we use is just use 100 cuts a minute. And with that, we have much better control. And once you have an opening, you engage the tissue underneath with the vacuum of the cutter and very gradually pull it out. This is the same technique we used to use with small membranes using a forceps. But nowadays, those are treated with anti-VEGFs. But these bigger ones, we like to treat surgically. And you can see a smiley-shaped incision which was there. And rinse off all the residue of all this tissue, put some perfluorocarbon to give pressure over the macula, and then align the retina back in its place. So you can see that whole bulk of tissue has gone away from there. And this is a 1 month picture of that, and the macula looks fairly healthy. The scarring is where the superior arcade is, with some pigmentary disturbance due to the membrane, but the fovea is reasonably well as compared to what was there before. So this is, in brief, some of the surgeries that macular surgeries that we commonly do nowadays, and it's all possible with the advancement of these newer instrumentation and techniques which have been evolving over a period of time and allow us to do that. So thank you very much, and I'll leave you with this image of Gaurav during his residency time with Rituraj, and I'm sure they're having a great time, and maybe he now does a real guitar by now instead of holding a prop. He would be able to tell you better. But thank you very much for having me on this program. Thank you.
Thank you. Thank you. Thank you, sir.
Thank you very much, Nagpal sir. You have shown all the presentation, a very, very delicate part of the surgery. Macula, I suppose, is the most delicate area, and the way you are doing the things, it's great. It's great.
Thank you. Thank you.
Now I would like to call upon Dr. Deepak Purohit. He will introduce his closest friend, Dr. Suhas Haldipur sir. Deepak Purohit.
Yes, good evening.
He's an orthopedician, and his closest friend is Dr. Deepak Haldipurkar. Suhas Haldipurkar. I'm sorry.
Okay, can you see the screen?
Yeah.
Can I start? Hello. Can you see the screen?
Yes, very much.
Okay.
Please start. Please proceed.
Good evening, my friends. There is a famous saying by Henry Longfellow. It says that the heights by great men reached and kept are not attained in a flight, but they, while their companions slept, were toiling upwards in the night. When I look towards Suhas, I always feel how true it is. Born and brought up in green and serene Karwar, amidst the bountiful nature, he graduated from Medical College of Hubli. Suhas came to Mumbai with a dream in his eyes of becoming a general surgeon. But destiny thought something else. She saw an outstanding ophthalmologist with magical fingers, and Suhas became ophthalmologist under watchful eyes of Dr. Sathe. That was a time when ophthalmology was not a glamorous branch as it is today. After his graduation, he incidentally landed in Panvel by another stroke of destiny and started his career. But he was endowed with two gifts, a gift of continuous learning and foresight, and the second gift of making untiring efforts. From a very modest beginning, he started his career, and in no time, he became a popular eye surgeon in the Raigad district due to his soft nature, good skills, and humane attitude. He did not sit comfortably with his newfound success, but pursued his learning in Japan and Germany, which widened his horizons and opened before him the new field of intraocular lens implantation and phacoemulsification. He grabbed this opportunity with both hands and never looked back. I remember that it is said that luck happens when preparation meets the opportunity. He became one of the pioneers of intraocular lens implantation and phacoemulsification, and with no one to guide or to handhold him, only by looking at someone and then doing the same surgery on our private patients needs real courage and confidence. He showed it, and the success was at his feet. He was very meticulous to keep the records of all his surgeries, and he could present his outstanding work in India and abroad, and everyone acknowledged the phenomena called Dr. Suhas Haldipurkar, a surgeon and a teacher par excellence. He practically got all the honors in ophthalmology in India and abroad. Like in 1994, he was awarded V.K. Chitnis Oration. In 1999, his selection was for the Winter Academy in Austria. He got Karmayogi Puraskar from Bombay Medical Aid. He got Ishwarchan Award from Ophthalmic Society, Best Teacher Award, Best Ophthalmic Premier League Award, and so on and so forth. Later on, he started Lakshmi Charitable Trust, a Lakshmi Eye Bank, and Lakshmi Charitable Hospital with its branches as a part of his philanthropic activities. Till today, he has operated over 80,000 patients free of charge through his charitable activities. Lakshmi College of Optometry and various postgraduate fellowships became routine part of all his activities. Panvel soon became Mecca of difficult eye surgeries thanks to Suhas, and no wonder that luminaries like Pula Deshpande, Baba Amte, and other prominent personalities from social and political fields became his loyal patients. Suhas still finds time to work for Rotary. He is a past president of Rotary Club of Panvel. He likes traveling, reading, photography, and enjoying his free time with his friends and colleagues on his farm. Many of us feel that Jayu as we call her, came in his life and proved to be his lucky charm. True to her name, she brought Vijayanti in his life, an artist by heart and a true companion, helping him and guiding him, supporting him in all his ophthalmic activities. Tanvi, his elder daughter, has picked up all the right genes from Suhas and is fast becoming a skillful eye surgeon, while Shamika is a budding entrepreneur. Let me present to you our dear friend, kind-hearted, loved and respected by all, an international and acclaimed ophthalmologist with his strong roots in Panvel and humble to the core, Dr. Suhas Haldipurkar. Thank you.
Dr. Haldipurkar, please.
Yeah.
Yes,
Hello.
sir, please go.
Can you hear me? Yeah.
Yes.
Thank you so much. Shekhar, you couldn't have chosen any other person to speak such nice words about me. Deepak, thank you so much. Dear Dr. Shekhar, and all the honorable, esteemed members of this faculty today, whom I have interacted and known for quite some time, all the members of your Paranspay family, the IMA members, and my colleagues from ophthalmic fraternity. It's indeed a great honor, Shekhar, to be chosen on the first Memorial Day for an oration lecture. I thank you so much. Dr. Bhaiyyasaheb Paranjpe indeed was a Rishi, and he had magical touch in his hands, and people thronged from far and wide to be treated by him. In fact, there were many ophthalmologists. He helped them find a roadmap to the future career, and I was no exception. Like Dr. Quresh has said, in fact, Quresh has covered it very much in detail. He used to conduct small workshops where young ophthalmologists would be trained in lens implantation. And in one such workshop, during annual conference in Belgium, I happened to see this phenomenon, and rest is the history. In fact, over the years, I have had several interactions with him. I can quote quite a few of them, but since I also have a limited time and I also have to cover a topic which was so close to his heart, I would revert to the talk. And today, I'm acutely aware that the crowd is a mixed crowd. So I would try and tone down my talk so that it is accepted well. At the same time, I only hope my ophthalmic fraternity will bear with me. With these few words, I would share my screen and take to my talk. Is my screen seen, sir? Hello?
Yes, Suhas.
Yes.
Oh, thank you. So, my talk is going to be on the IOL surgery from the days of Bhaiyyasaheb to where it stands today. And it's a very interesting story. But before that, I just want to touch on this photograph. Over the years, I'm sure Sir would have received several accolades and awards. And the last one from Maharashtra Ophthalmological Society obviously was the Lifetime Achievement Award. And I just happened to be the president during the time when he was honored. And subsequently, even the All India Institute, All India Ophthalmological Society honored him with Lifetime Achievement Award. Now, from the days that he was operating, that was 1980 to 210, it's considered as golden era in cataract surgery because everything changed in surgical techniques, types of lenses, and the concept of good vision itself. If you take cataract removal techniques, manual extracapsular cataract surgery was what our Guruji was doing. From there, it changed to a small incision surgery, and then came the phacoemulsification surgery, and then finally it rested on femtolaser assisted surgery. But today we have RACOS, which is a true laser cataract surgery. But I'm sure many of my ophthalmic colleagues probably have not heard of it because this is a technique which is used in Russia, and there are almost more than 130 installations. Now, it's an amazing technique. You can see the laser is literally melting the nucleus, melting the cataract, even if it's hard, and the irrigation aspiration system just has to absorb it. But it's a sad fact of the matter that in spite of such a technique existing and practiced in more than 130 installations, uh, there's no way this technique can come out of that country, not even to India, thanks to all these bigwigs, the multinationals. Talking about the vision itself, all of us are familiar with this chart. Now, this is a Snellen's chart, which is 170 years old concept. What it said when it says 6 6 is that there are small high contrast letters on a white background are measured. But this is only one part of vision, and vision has got several shades. Now we talk in terms of quality of vision after lens implantation. Let's say the vision after sphere and cylinder are corrected, which is the normal vision which we used to get with the previous existing intraocular lens implantation, or sometimes with your glasses. Then the next level is vision after spherical aberration is corrected. After that, the next level is when vision with chromatic aberrations and contrast vision is corrected. And finally, a vision after higher order spherical aberrations are corrected. The first three are corrected with the newer and newer lenses, and the final one still cannot be corrected with the lenses, but it requires laser to work on the cornea. But what we really are bothered about is the everyday vision, which is called functional vision. So the efforts are to get a good functional vision. Now, if you look at the two the lamp houses, the one is it has a different and a more sharper and better colors rendition, and that's because the improvement in the image quality is purely because of aspheric correction. Today we have lenses, and that's a norm today that most of the lenses that we use are aspheric lenses as against the spherical lenses in the past. With phacoemulsification became popular, obviously we had the foldable lenses. And when the foldable lenses came, they came in all the shapes and sizes. And then finally, every lens had its one feature that was added. And finally, all these things went off, and we are left with very few designs. And if you look at this is a very interesting one. This was video 10 years back. Some of the new ophthalmologists probably have not tried this. This is the holder and folder method. And the lenses that we used in those days were silicone lenses, and those were notorious because they were slippery. And when you try to fold it and hold it with a forceps and try to insert it, sometimes it just popped out. So that means you always had lump in your throat till the lens went in. So with the advent of phacoemulsification, there was always a demand for spectacle-free vision for near and far. So that led to the birth of multifocal lenses. More than a decade was spent perfecting the optics and the way to address the issue, because initial multifocal designs were disastrous. The time was spent on perfecting the lens formulae, because with a better formula you would get to be on a bullseye. Then again, the efforts had to be put for fine-tuning the art of counseling, because we knew that with multifocal lenses not everyone was happy, and we had to choose the right candidate, And even to that candidate, we had to tell what to expect. So this was quite a tough time in the initial period. What are the common issues with multifocals? They always landed up with halos and glare, and patient had to be forewarned before that, well, if you want to go for multifocal, these are the things that you have to live with, and after a while, your neural adaptation will take care of it. And efforts were all the time on to reduce them. But what really bothered us most was the contrast vision, especially in a dark night. The vision with multifocal lens really did drop, and that was quite disastrous. So we had to have improvements because there was some light lost when creating a multifocality in a lens. So this contrast vision became really important, and it had to be taken care. So like Dil Mange More, or Dabang Part 1, now the patient demand became different. They said we want better quality of vision even for intermediate, in addition to near and far. That was understandable because the lifestyle had changed. And then the second demand was a vision without need to look for spectacles, which was also understandable. And finally, the patient said, I want identical vision for day and night. So with all these three things, because the changing lifestyle had shifted to digital platform, and the usage of computer and smartphones and the tablet or iPad had suddenly increased. And now we felt the need for an intermediate vision was more important than vision for near. And it was understandably so, because when you went to a mall, you couldn't read the product labels on the shelves at a grocery store because you had two foci, one for reading and one for distance, and all these things were at an intermediate distance. So you literally had to go closer to it to read. And if you're sitting in a car, the dashboard instruments in the car were hazy or fuzzy. And that's the reason it was inevitable that we would have trifocals, and they were the onset of beautiful trifocal with all the kind of different demands. So naturally, the bifocal optics, which had two foci, one for near and one for distance, had to give way to a trifocal design in which there was one for infinity, that was for distance. Then once the light fell onto the lens, it had to have one focus for near and the second focus for intermediate. And the near was 40 centimeter, intermediate or 80. But these two things could be varied depending on the add power, and different companies had different add powers to suit the patient's needs. So now the Dil Mange More Part 2, when we thought that they lived happily after that, the demands this time was a seamless vision from near to far with no interruptions. Now, sometimes you wouldn't understand what is seamless vision, because when you had a trifocal, you had one focus for near, intermediate, and then for distance. But between the near and the intermediate, there was a spot where the vision slightly dropped. But the patient said, I don't want it, I want a seamless vision. So then there was a birth of something called EDOF, which is extended depth of focus. The optical industry is so smart and all the time working that quickly when the demand came, there was a birth of this. Like today, it's not the multifocal or a bifocal or a trifocal. The patient would say, Doc, I would want an EDOF. And what the industry did was a very wonderful thing. When the light comes from far, normally in a trifocal, it would give you two foci, one for near and one for intermediate. So this time they tweaked with the optics. The diffractive optics was used. And instead of giving two foci, it gave you one single elongated focus. And by doing that, you had a seamless vision from distance almost to intermediate and to the outer outskirts of near. That means from this point, which is the outskirts of near vision, till the infinity, the patient had um, um, the seamless vision. But still, this design could not give you something for near, but the patient was not going to accept it. So today what we have is a synergy IOL, and Techniques is the platform. Today there are 3-4 different platforms which are established over the years, and Techniques is one such platform which is equipped with ability to take care of asphericity, take care of chromatic aberrations, take care of contrast, And now on that platform, they added another new design, which is a synergy, a breakthrough innovation. So the presbyopia solution that delivers continuous high contrast vision from near through far to near, even in low conditions of day and night, was born. And today, this is probably the standalone piece that's going to offer solutions to all your problems. And there was one long-standing problem that most of the lenses really could not solve, and that was when you're sitting in a restaurant with a dim light and you wanted to read your menu. It was little difficult to do it in spite of having both eyes with one of these lenses. So you had to have additional light, or you had to use your mobile to put some light on that. And that was one demand which was all the time long pending. So that problem has also been taken care by the supposed to have been taken care by the Technis Synergy lens. At the same time, there were another 2-3 lenses which also wanted to be in the EDOF arena, and one of them was Minivel, which decided to use totally a different concept. All earlier lenses were using diffractive optics, where there were a series of lines which had a tendency to cause the glare and halos at night when you're driving. But here they decided to use the positive and negative spherical aberrations in different zones to give you some amount of depth. So the 3 circular zones, each with a different aspheric profile, creates a range of focus, and this became one of the well-established EDOF lens, but it also lacked the near vision. So in such cases, we had to use a mix and match between the 2 lenses to finally get a good reading vision. And finally, we had a lentis comfort. This is also another EDOF lens, again not having any lines but using spherical aberrations. And what it does is it has got 3 different lenses. One is a near dominant, one is a distant dominant. And so a combination of 2 will take care of a seamless vision all throughout from periphery to the near. So you'll wonder what this seamless vision is. Now, this seamless vision is, let's say, in this picture, the person is reading a book where the letters are hazy, but the intermediate area, this chart is clear, this is clear, the laptop is clear, and from here till the periphery, there is no obstruction anywhere. It's a seamless vision. Now, this is the vision that today with the lenses we offer, and with the new lens, probably even this is taken care. So in conclusion, I can only say that Bhaiyyasaheb would be too happy to note that from where he left, we have progressed so far and very little left to reach the final mark. With this, I would like to thank you. And Shekhar, it's a good session they have conducted. And for calling me here and honoring me, I'm really indebted to you. Thank you so much.
Thank you very much, Dr. Purohit and Dr. Haldipurkar. Thank you very much. We all are eager now to listen Dr. Prakash Amte. Hello.
Yeah. I'll just.
Dr. Prakash Amte, are you ready? Can you hear me, sir?
Yes. Hello. Yes. Yeah.
So please go ahead. You are audible now.
First of all, I thank Dr. Shekhar for inviting us for this beautiful session. Though it was much technical, we could learn a lot from the awardees you selected from all over India. Personally, of course, we knew Dr. Haldipur right from, say, 1998. Mrs. Purva Deshpande, Sunita Bhai Deshpande. The problem of eyesight with Baba and my mother Tai. So she insisted that you should go to Panvel and get operated. So that was the first visit to Lakshmi Eye Institute in 1998. And my mother got operated there. Baba was fighting for the Sardar Sarovar Dam in Madhya Pradesh. And he was avoiding his operation. Because he could see a little bit of with the cataract in his eyes. But my mother and we convinced him. He came right all the way from Madhya Pradesh to Mumbai. And the friends in Mumbai, they were very wondering why he has chosen to go to Panvel. For them, probably it's a very rural area. So much of experts are there in Mumbai. Why do you want to go to Panvel and get operated? That's how they almost opposed him to go to Panvel. But somehow I came from Embalkasa, I accompanied him. And then since then, he operated upon Baba's both the eyes. And he was so happy. The first operation, he was in his special room there. And as soon as he opened his eyes, he said, I could see an ant on the wall walking in the wall, small ant. He was so happy. And since then, we got very close association with Dr. Haldipur. We both got operated incidentally after some years. And as for the Bhaiyyasaheb's, we were lucky to have met him. We have visited his hospital in Sangli. I had very fond memories. I got even examined by him. And I must thank Mr. Quresh Muscati for giving his elaborate introduction. Really, it was so nice to hear from him, close associate. And then finally, all the awardees, Dr. Manish Nagpal. I must congratulate him for his not only his ophthalmic work, but also for the collection of the stamps. Really would like to visit once his museum there and have personally see the collection of the stamps. I congratulate him and give him my best wishes for his career. Dr. Samar Basak also did a very good session about technical Disha Eye Hospital here. So I also congratulate him. Right now, of course, the heavy rains in this area, we are literally cut off from the world. We are fortunate that till now, I learned a lot from all these three doctors. Thank you very much, Shekhar. I mean, probably we are, probably Wi-Fi will be disconnected within any time now. So you can start the ceremony and hand over the award and everything. Thanks again. Thanks to everybody.
Yeah. Thank you very much, sir. Citation function is already over. I'm going to request Dr. Dipti Paranspay, Purohit, to propose vote of thanks. Thank you very much, Dr. Prakash Amte. Because connectivity appears little poor.
Yeah, yes, and it's going to
be.
Yes.
Is it? Oh, also we are quite in time. Dipti?
Yes.
Please propose vote of thanks.
Yes, okay. Yeah, hello everyone, good evening. After this wonderful time we all have had together for the past 1.5 hours, I'm really short of words to express the vote of thanks for today. In fact, I'm overwhelmed to share this webinar platform with the stalwarts. This is certainly going to go a long way in my memory. At the outset, I would like to thank our chief guests for today, Dr. P.N. Nagpal sir and Dr. Prakash Amte sir, for gracing the occasion. This celebration of life of my Azoba, Dr. Bhaiyyasaheb Paranjpe. We are honored by their presence today. Thank you so much. Thanks to Papa Patil Kaka for persuading Dr. Amte sir for join the meeting. I would like to thank the speakers, Dr. Quresh Muscati sir, Dr. Suhas Haldipurkar sir, Dr. Samar Basak sir, and Dr. Manish Nagpal sir, who in spite of being exceptionally busy, agreed to join in. Their talks were enlightening, enriching, and enjoyable. We are really happy to host the masters in their field. It was an honor. Thank you so much. A big thank you to Dr. Deepak Purohit, Dr. Gaurav Paranspay, and Dr. Viraj Pradhan for the crisp introductions. Thank you so much, Entored Pharma team, Mr. Kishore Masurkar, Mr. Nikhil Masurkar, Mr. Raman Marke, and Mr. Nitin Kulkarni and Rahul Jain for the tremendous support you provided. The efforts taken by them and the support provided is colossal. Dayanand Kaka and Jayashree Kaku, thank you to you too, not just for coordinating or comparing this webinar, but also for being a big support to I and Baba in organizing it. Really sorry. Very special thank you to the audience for taking a part, for being a part of this celebration. And lastly, thank you, Azoba. I'm super proud of him, not just for his contribution to ophthalmology, but more for his enthusiasm in everything he did, right from sports to cooking to arts and drama to being an excellent homemaker and taking care of Aji right till the end. He has always encouraged us grandchildren, his children and daughter-in-laws to pursue their interest in hobbies. I'm truly blessed to have him as my granddad. We miss you, Azoba. I'm really sorry for this. Once again, thank you to one and all on behalf of Ophthalmologist Social Association Sangli and Paranspay family. Hope you had a great evening. Take care. Thank you and good night.
Thank you, everybody. Thanks, everyone on the floor. Thank you very much. Thank you very much.
Thank you.
Thank you all. Thank you, sir. Thank you, Manish, sir.
Take care. It was good.
Thank
Thank you, everyone.